How you felt with PD classes? कैसा लगा आपको?
अच्छा लगा सर।
What changes you felt?
मतलब मेरा सर जो इंट्रो पार्ट और वो सब थे ना, वो बहुत ही वीक था। आज तक मैंने कभी कोई कोचिंग करी नहीं है इन सब चीजों के लिए। तो वो मैंने काफी इम्प्रूव किया सर।
So first of all, I want Dr. Swati, you should tell me about your hobbies.
Sir, my hobbies is painting, sketching. I like playing basketball. Other than that, I like reading fiction, and also uh, I like listening to music also. These
Okay.
all include my hobbies.
What are your strengths, your strong points?
When it comes to my strengths, I have good communication and leadership qualities. Also, I can understand like when it comes to people, I'm good with empathy. I have good adaptability, and when I have good respects for seniors, and I can do ample amount of work with precision. And also, I can like I can survive from anywhere from India, from Kashmir to Kanyakumari with
Oh,
minimum resources. I can produce maximum efforts,
that's good.
and I don't have any difficulty for homesickness or any issues.
Tell me about vaccination schedule.
So vaccination schedule, first is at birth, zero dose BCG, hepatitis V, OPV we'll give.
Okay.
After that, 6 months we'll give IPV first dose, pneumococcal vaccine, DPT. Then 12 months we'll give, 9 months we'll give same pentavalent pneumococcal vaccine. 6 months also we'll give rotavirus 1. And at 16 month, 6, 9, 12, 12 will give OPV, third dose, IPV, second dose, DPT or pentavalent. Then coming to ninth month we'll give MR and JE vaccines. And after that, IPV booster also. 12th month we'll give pentavalent booster, MR and JE second doses. Uh, then again 5 year will give TT first dose, and 10 year will give TT second dose. On 9 months also vitamin A doses we have to give.
Tell about circle of Willis.
So circle of Willis is a confluence of blood vessels present at the base of the brain. It is mainly formed by basilar artery and vertebral artery, and it is one of the major vessels which undergo stroke also, and that's it for circle of Willis.
What motivates you to join defense?
Sir, I like the discipline life of the defense, and also I have always seen my father who was in defense, so uh, I really want to be a part of the Army Medical Corps to serve, and also it has been my dream to be in the uniform to serve the nation.
Okay. Now you tell me about vector-borne diseases.
So vector-borne diseases may you have malaria, then dengue, chikungunya, then JE, then filariasis, elephantiasis, and there are other Kala Azar, which is mediated by sandfly. Then there is a Kaisner forest disease. There are tick-borne diseases. There are also this rickettsial, no, not rickettsial. There is Orangia Shushumgamushi disease, which is also mediated by soft tick and hard or soft tick. These all are vector-borne diseases, sir.
Epidemic disease in your area.
So if I talk about Bareilly, Bareilly has endemic diseases of malaria, cholera, and JE. And if I talk about Kolar, Kolar is having an endemic for fluorosis. There is diarrheal diseases very common in Kolar along with JE. And Karnataka is having endemic of Kaisner forest disease also.
Tell me about frostbite.
So frostbite is occurs in peripherals of the body, especially when it is exposed to very low temperatures. It is due to vasospasm of the blood vessels, and the treatment for frostbite is rewarming with normal temperature, and we can also give vasodilators like uh, calcium channel blockers and all we can give for the management, and it contains rewarming also.
Tell about amenorrhea.
So amenorrhea can be physiological or it can be pathological. If in physiological amenorrhea is basically absence of menses for in female already who already had menses before. It can be primary or secondary. Primary will be absence of menses in female who have never uh, attained menstruation by the age of 14 years with no secondary sexual characters. And in secondary amenorrhea is amenorrhea in females who already had menstruation and is now supposed. In secondary amenorrhea, pregnancy is one cause, lactation is one cause, and in pathological amenorrhea, we can have cryptomenorrhea due to septa present or due to uterine anomalies. It can be present. We can use progesterone challenge test or estrogen challenge test to diagnose the causes of amenorrhea.
What is the root cause of adenomyosis?
Root cause of adenomyosis is in
When the
reflux of
cells that normally line the inside of uterus also grow in the layer of muscle in the wall of uterus.
Yes.
Tell me the types of fractures.
So fracture is a breach in the continuity of the bone. Types of fracture we can have open or closed, and based on the type of fracture, we can also use that as compound fracture, spiral fracture, or open fracture is basically when the bone is fractured and is exposed to the environment. Closed fracture when the epithelium or the skin layer is intact and the fracture. Other than that, there is stress fracture, which is due to repetitive pressure on a particular bone. We especially get it in metacarpals and shin of tibia.
Tell me types of joints.
Sir, joints can be simple joints and compound joints and fibrous joints. Fibrous joint is present in the skull area when we have, and in primary joint, we can have cartilaginous joint, and in that we have primary and secondary. In that also we have syndesmosis is there, and then there is hinge joint, then ball and socket joint, there is saddle joint available, and other than that, in secondary cartilaginous joint, when it is present in the axial skeleton, like in between pubic symphysis, in the sternum, Ziphy sternum, and
How you felt with PD classes? कैसा लगा आपको?
अच्छा लगा सर.
What changes you felt?
मतलब मेरा सर जो इंट्रो पार्ट और वो सब थे ना, वो बहुत ही वीक था. आज तक मैंने कभी कोई कोचिंग करी नहीं है इन सब चीजों के लिए, तो वो मैंने काफी इम्प्रूव किया सर. और अभी तो आगे इंटरव्यू देंगे.
चलिए, tell me about dehydration management.
Sir, when a patient comes with dehydration, we classify. If it is a child, we classify the treatment with IMNCI guidelines, and we in IMNCI, if we have to check the patient have a mild, moderate, or severe dehydration. If it is a mild dehydration, we can just give oral fluids, ORS, and we can discharge the patient and ask the mother. If it's a baby, we should ask the mother to feed properly. If it is a moderate to severe dehydration where skin pinch is slow, baby is NF very thirsty and all, we have to give IV fluids also based on the age of the baby, how old is the baby. So we have to give ringer lactate solution, and for severe dehydration also we have to give IV fluids mainly, and as per need we can give ORS.
Do you have job experience?
Sir, I have done internship with 3 months of postings in district hospital SNR. Other than that, I do not have a job experience.
So what type of patients and what type of emergencies you handled during this 3 months tenure?
I have seen a case of status epilepticus. I've also seen a patient who came for stroke, and our RTA cases we have seen, which has come for us. And then there was a case of MI, then breathlessness cases we have seen, sir, and OP poisoning cases where there's snake bite cases, dog bite cases we have seen, and other than that, trauma and laceration cases we have seen, sir.
Wonderful interview. Good.